Adenomyosis, another common disease of the uterus that can cause pain. It's more common than what we thought. We see it in 70 to 80% of Paris women. 70% are symptomatic. Transvaginal ultrasound has pretty high sensitivity, specificity, and accuracy. Sensitivity of 80 to 86%, specificity of 50 to 96%, and accuracy of 68 to 86%. Adenomyosis may present as two types, diffuse or focal. The focal is nodular and sometimes referred as adenomyomas. Patients who have adenomyosis present with uterine enlargement, pelvic pain, dysmenorrhea, menorrhagia. Adenomyosis is due to migration of glands from the basal layer of the endometrium into the myometrium. These ectopic glands are seen 2 to 3 millimeters below the endomyometrial junction, and they're often misdiagnosed as leiomyomas. The sonographic findings of the diffuse adenomyosis is uterine enlargement with heterogeneous appearance of the myometrium. There is usually an asymmetry between the myometrial walls, with the anterior wall being thicker than the posterior wall. Subendometrial tiny cysts or nodules may be seen in 50% of the cases, and this most likely reflects the cyclic functions of the endometrial glands. The focal, the sonographic findings of the focal adenomyosis is ill-defined echogenic mass or an adenomyoma. Color and power Doppler ultrasound demonstrate the penetrating vascular pattern within the mass, which helps to differentiate these from the fibroids. Fibroids are well-defined hyperechoic mass with vascularity in the periphery of the mass. And here's a nice example of diffuse adenomyosis. Transabdominal study, longitudinal view. We see the endometrial cavity. You see that the uterus is markedly enlarged. The anterior myometrial wall is thicker than the posterior myometrial wall. Very heterogeneous myometrium. And within the myometrium, you can see these little cystic areas, which are probably glands. And on color flow, you see how diffuse and how the vascularity enters the mass, different than in fibroids, in which the vascularity surrounds, outlines, it's in the periphery of the mass. Another patient, 2 views showing very thick anterior myometrium compared to the posterior myometrium. The endomyometrial junction is not seen here. This is typical of adenomyosis. We know that MRI has a very high sensitivity and specificity for diagnosing adenomyosis. The diffuse form of adenomyosis is seen on MRI as a uterine enlargement with diffuse thickening of the endomyometrial junction. Normally, the endomyometrial junction's width is about 8 millimeters. When it's widened greater than 12 millimeters, it usually represents diffuse adenomyosis. Endomyometrial junction of 8 to 12 millimeters is sometimes associated with focal adenomyosis. Low signal on T2 weighted represents the hypertrophy of the smooth muscle surrounding islands of heterotropic endometrial glands. And here's a nice example of adenomyosis on this MRI. We can see that the myometrium is very heterogeneous. The one anterior wall is much thicker than the posterior wall, and the endomyometrial junction is thick. You cannot see the anterior part of the endomyometrial junction here. Management for patients who are symptomatic with adenomyosis can be medical treatment, hysterectomy, or also urinary artery embolization has shown to improve dysmenorrhea and menorrhagia in these women. Another cause of pain in women is pelvic inflammatory disease. And endometritis in the uterus can be seen or identified, and it's usually associated in patients who already have pelvic inflammatory disease or after a D&C. Sonographic findings in the endometrium include increased echogenicity, as you can see here in this transvaginal study showing thickened endometrium, or sometimes, occasionally, we can see acoustic enhancement. Occasionally, we can see fluid. And the presence of gas can be seen in 21% of the patients and confirms the diagnosis. Here you see two different patients with complex fluid collections. These two patients have endometritis. On this patient, the complex fluid collection can mimic a pseudoestational sac, which can be seen in ectopic pregnancies. Another patient, transabdominal study, shows a longitudinal view of the uterus, a complex endometrial fluid collection. Within the fluid connection, we see this linear echogenic structure. Transvaginal better delineates the endometrium. We see nicely the mucosa of the endometrium, echogenic complex fluid collection within the endometrium, and this curvilinear echogenic structure with shadowing consistent with gas. This confirms that this is endometritis. Pain can also be due to cervical stenosis, and cervical stenosis may be due to chronic cervical infection. Treatment of endocervicitis or surgery to the cervix can cause cervical stenosis. The definition of cervical stenosis is the inability to pass a 2.5 millimeter or less probe into the canal. This causes, cervical stenosis causes distension of the uterine cavity, hematometra, hydometra, pyometra, and all these may cause cramps, spasmodic, suprapubic pain. In the premenopausal woman, the pain may also be associated with oligomenorrhea, amenorrhea, and dysmenorrhea. Cervical dilatation is usually the treatment that is done and can be done with ultrasound guidance. In postmenopausal women, endometrial fluid collection may be due to carcinoma, endometrial or cervical, endometrial polyps, status post-radiation therapy, but the most common cause of endometrial fluid collection in the postmenopausal woman is probably exogenous estrogen administration due to some degree of cervical stenosis. Here's a postmenopausal woman. Transvaginal ultrasound shows marked distension of the uterine cavity by fluid due to cervical stenosis. In a hematometra, or maybe due in a postmenopausal woman, to reactivation of endometriosis. These women are usually taking hormone replacement therapy, and as you can see here on this transvaginal study, dilated, distended endometrial cavity with homogeneous fluid, which was blood. And here again, you can see distension of the cervical canal with fluid. And these were two patients who had cervical stenosis secondary to, because they were postmenopausal.